Today we're going to talk about a skin concern that affects many women, hyperpigmentation, specifically melasma. We'll cover what it is, what causes it, and how to best manage it. So let's get started. I'm Dr. Hannah Kopelman. I'm passionate about teaching you about skincare. If you're new to my channel, don't forget to hit the subscribe button below. Melasma is a type of hyperpigmentation that appears darker than your normal skin tone. So normally it appears as brown or grayish brown patches on your face. Usually you see it on your cheeks, sometimes on your forehead, even above your lips, and more rare, but you can see it on your forearms. It is most commonly seen in women, typically those with darker skin types. So if you're Asian, Hispanic, you're usually most affected by this condition. Men can also be affected by melasma, but it's less common. While melasma isn't harmful, it's not itchy or painful, so you normally won't get any symptoms associated with it. It is a source of self-consciousness for many people. I know that my friends feel really bad about how they look with it. I'm here today to try to help you best manage it. The exact causes of melasma are not fully understood. However, there are some factors that we believe contribute to the development of melasma. Sun exposure is thought to be the #1 cause and trigger for melasma. So usually summertime is not the best time for those with melasma because we're spending more time in the sunshine. Another very common trigger is hormonal changes, those that occur during pregnancy. Believe it or not, this is called the face of pregnancy. It also can be seen when you are taking birth control pills, even with IUDs, or if you're doing hormonal replacement therapy. Because of that increase in progesterone and estrogen hormone, you actually start to develop hyperpigmentation on your face, on your forehead, and in other places. So like I said, sun rays and UV light rays are one of the main drivers of melasma. That's because UV light rays stimulate the production of melanin, which leads to the darkening of your melasma. So if you're someone that enjoys going outside, definitely put on your sunscreen. But you should also be putting on your sunscreen even if you're inside, because the light from above from your light bulbs can also be causing your melasma to get darker. Genetics can also play a role in the development of melasma. It's possible that your parents or your siblings might have it, and that might be why you have it as well. Heat is another contributing factor for melasma. So if you're someone who likes to go to hot yoga or go in saunas, you might come out and realize that your melasma appears darker. And that's because we believe that melasma has a vascular component to it, which when you're in a hot room, your blood vessels are getting dilated and you get hot, and it's stimulating that darkening and pigment on your skin. I do want to mention that there are certain medications or autoimmune conditions that can cause this melasma-like rash or mask-like rash to appear on your face. So I don't want you to get confused whether you have melasma or you have another condition. Melasma typically won't be associated with any other signs or symptoms except for that hyperpigmentation that you might see on your face. So if you're conflicted about whether you have melasma or another condition, or you're taking a medication that can be causing this hyperpigmentation, it is best to consult with your dermatologist for proper diagnosis and treatment. Now, unfortunately, I have a spoiler alert. Melasma is a chronic condition. There's no permanent cure for it. With that said, I'm going to talk and go over all the ways to best manage it. First and foremost, I think it's important to set realistic goal expectations. If you're someone who developed that mask of pregnancy, so you developed the melasma during your pregnancy, it's very likely and very common that this mask and this hyperpigmentation that you've developed on your cheeks will go away a few months after delivery. However, if you're someone who's predisposed to melasma because of genetics or other factors, then unfortunately melasma is kind of stuck with you. But don't worry, there are suggestions I can make today on how to best manage it and prevent it from getting worse. So let's start with some of the tips. First and foremost, you might have to make some lifestyle modifications. If you're not someone who's such a big fan of sunscreen, even though you should always be wearing your sunscreen, you need to start. It is key. You need to use an SPF that blocks UVA and UVB rays. The UVA rays are those that prevent wrinkles and aging, and the UVB rays are the ones that prevent burns. So it's so important to be using an SPF with at least 30. Apply it frequently throughout the day to reduce the darkening of your melasma. I recommend using a daily SPF that is tinted. That's because it contains an ingredient called iron oxide. And this iron oxide actually helps reduce the darkening that we get from the sun on your skin, so it helps for melasma. Now, we can't really help going outside and going to the store, so if you're planning on going outside or taking a walk, which I highly recommend, I'm a big fan of it too, wear a wide-brimmed hat and try to avoid the sun during those peak hours. This is the best way to reduce the pigmentation from getting darker and prevent new lesions from occurring. In addition to sun protection, which is key to managing melasma, there are several other topical treatment options that can help reduce your melasma. Let me go over what's on that list. So hydroquinone, that is first line. This is a lightening agent that can help reduce your melasma and the pigmentation. Hydroquinone is an ingredient that works by inhibiting the pigment cells from producing melanin. And melanin is what is causing that hyperpigmentation on your face. So with hydroquinone, we can stop the production of that pigment. In addition, you can find products like vitamin C, niacinamide, and kojic acid. We're going to go through all of them today. However, I do want to mention, before you start any of these products, it's best to consult with your dermatologist because some of them can be irritating to your skin. Now, it's very typical for your dermatologist to prescribe you with a compound. What this means is they're taking hydroquinone, a certain percentage, so it's going to be at least 4% and above. Sometimes it goes up to 12%. They usually combine this with a tretinoin, which is a retinoid, and sometimes they add kojic acid, vitamin C, or even a steroid. However, sometimes you want to err on the side of caution with the steroid because their overuse of steroids can thin your skin. Now, I want to go over the skincare routine for how to use this compound once you get it from your dermatologist, because this is really important. First and foremost, you don't want to overuse this compound product. You only want to use a small amount, so like almost like a pea-sized amount on your finger. You can see a pea size right here. Apply it just to the dark areas. So whether you have it in your cheek area, your forehead, your lips, wherever that hyperpigmentation might be, only apply a very thin layer to those areas. And only use it about 1 to 2 times a day, twice a week. So don't use it more than that. If you're tolerating it okay and it's not causing too much irritation, you can go up to 3 times a week. But you don't want to use it for more than 12 weeks at a time. So once you hit that 12-week mark, stop, put it away. You can store it in your refrigerator. It's completely safe and it will store well. And you can use other products in the meantime as maintenance, or you can give your skin a total vacation. And then a few months later, if you notice your pigmentation is getting worse or flaring again, you can go back into your refrigerator, grab that compound, and start using it again. But it's really important to just use this sparingly. 2 things that are important that I want to emphasize. One is the reason you want to use this product sparingly is because it can lead to other problems, like something called ochronosis. It's not a complication you want to have. So listen to me, use it sparingly, and you'll be happy. Another really important recommendation and really a suggestion is this is not recommended. Hydroquinone is not recommended for use in pregnancy, nor is tretinoins. So if you're someone who is pregnant and dealing with melasma, hydroquinone and tretinoins are not the right option for you. You can use something called arbutinin. Arbutinin is safe in pregnancy. My recommendation is if you're pregnant and unfortunately dealing with melasma, be very careful about the products you use and choose to put on your skin. Now, I get a lot of questions about vitamin C and azelaic acid. These are both great options for brightening the skin and reducing pigmentation. However, if you want it to be as effective as the hydroquinone, then you need to use at least an azelaic acid that has 20% to be comparable to a hydroquinone of 4%. Azelaic acid is another great option if you're pregnant because it is safe in pregnancy. Now, there are some over the counter and very affordable options that can help reduce the pigmentation causing your melasma. These include tranexamic acid, niacinamide, kojic acid, licorice root extract, cispera, and as I mentioned, vitamin C and azelaic acid. Now, if you're someone who hasn't seen great results with the topical options, there is another option for you. There's an oral prescription called oral tranexamic acid, which has been shown to be very effective at treating melasma, especially for those with refractory melasma where nothing else has really worked. However, if you're someone with a past medical history of blood clots, then this medication would not be for you. In addition to the topical options I mentioned and the oral medication, there are some in-office procedures that can help reduce your melasma. These include IPL, which is intense pulse light therapy, as well as the CO2 laser. In addition, you can try chemical peels and microdermabrasions. I just want you to remember that these treatments are not permanent. You kind of have to continue them for maintenance therapy. We covered a lot today. We talked about melasma, what triggers it, what causes it, and how to best manage it. There's one thing I really want you to take away from this video, and that's to wear your daily SPF. Whether it be in a sunscreen, a face moisturizer, or a concealer, try to pick one that has some tint in it. That way, you're protected against both the UV rays outside and the blue light from your phone or your computer, and you'll be covered all day long. I hope you found this video on melasma to be valuable. If you have any further questions, or if you're using a product for your melasma that works for you, please leave it in the comments below. I want to know what works for you. Don't forget to like, share, and subscribe below. I'll see you in the next video.